once said that it takes courage for a single person to start something, and it matters that even if it is only a single person, that is how all changes in society are brought about. And I applaud the courage of all of you who have come here today, in spite of not having a very substantial background, and your curiosity and your involvement will take you a long way, because the future of Indian healthcare depends upon having scientific concepts like case mix systems, which are used in the management of institutions, in the decision making at the policy level, in the scheduling of patients, especially for nurses at the duty and shifts, and also in demonstrating quality and in the contracts with insurance companies in their payment systems and financial systems. It is a very special day today because we have amidst us a very special person, Professor Marie Rodriques. Professor Marie Rodriques is probably one of the most renowned person internationally on case mix systems. His work goes back to 1982, where he pioneered in the whole of Europe the DRG system by introducing DRGs into France. He's also been closely associated during that time with one of the innovators and the person who discovered or invented DRGs at Yale University. And he's here. He has been kind enough to travel all the way to be with us today and to share a very wide perspective on the idea of DRGs. We have actually had some discussion with him. Even yesterday I spoke with him, and as of now we have planned at least 2 or 3 similar sessions, but at different levels. Today's session is titled Opportunities for Indian Healthcare, meaning what we are focusing today is on the concepts, it's on the basics, and so the implementation aspects and the kind of implications that it has for Indian healthcare, and especially the future of Indian healthcare, would be in the further sessions. For example, in Bangalore, we are planning a few months from now a session on the same topic with a slight change. It would be DRGs, or diagnosis-related groups, approaches for Indian healthcare, where we will engage with various reports like the Bain, the Ernst & Young report, and the CII report, and the work done by the FICCI, and all those, including a lot of researchers in various university departments, especially the IITs in Chennai and the health economics associations in India. We began planning this program about, I could say it's 1 month or 2 months, depends on how Professor John wants to look at it, because initially when he wrote to us about his willingness to come, there was a problem in the communication in the email, and then we had to take up the whole agenda all over again, and we have managed to have this program. And I think it is to the credit of everyone here that we did not say, we said we are going to go ahead at any cost. And I'm sure this will start a movement in India for case mix systems, and each one of you will have an opportunity to play some part in it. Now, the subheading for this program was Future Search. So I need to explain very quickly without taking much time, because John has to start a session. One quick way of looking, or kind of giving you that perspective, is that Future Search is the other end of the spectrum of research. We are all used to using the word research and development. So research is basically when you look deeper or more closely into something which you already know. Future Search is something which you look forward into the future, what you may not know. So you're going from, in the case of research, you're going from what you know, you want to know more. Here, even if you're looking at things which you've not heard of, which you have not had an opportunity to work with, you're going to have to, throughout the day, you'll have an opportunity to interact and learn more as you go. Now, the arrangement we have made is, basically we wanted this program to be a very participative program. So we have actually had the good opportunity to have Santosh Nair, Mr. Santosh Nair, who's probably the only expert right now in India who does graphic recording, or he's the best known. And he graciously agreed to be part of this program. and to facilitate the program. He would be with us in the next programs. We will be having much more interactive sessions. But to start with, we thought, let's have people here, let's talk about it, and we are all in the same kind of in the room and share all our views. And any hesitations, any questions, I'm sure Professor Jean will be willing to answer questions as he goes along. Professor Jean is a professor, and he was the first chair of the Department of Public Health and Medical Informatics at the University Etienne in France. He went on later to a very outstanding career in medical informatics, in setting up the infrastructure for France, and later on going deeper into a very specific area of informatics called ontology or disease informatics or terminology, where many of you might have heard the WHO's ICD coding systems. Many of those programs, he has been in the boards of in the committees, and he has contributed extensively. And much more recently, or I should say, I'm using the word recently in the historical sense, but since I think more than 30 years now, or the 25 years now, Professor Jean has been the chief architect of the Patient Classification Systems International, which runs very, very famous and prestigious schools. The most recent one was in Avignon in southern France, and they have an advanced school which is at Nicosia. So these are some of the areas in which Professor Jean works extensively, and he is going to be part of whatever we do in India. He has been to India before, and he has already expressed his affection for various aspects of India and his willingness to guide us, starting with this meeting, but into much more kind of involved, and more expertise will be brought into the room as we go along in the future meetings. I now invite Professor Jean to come forward. It is our pleasure to welcome Professor Jean with a bouquet, and I invite Sister Jancy Thomas to hand over the bouquet, please.
So, good morning, everybody. So thank you, Prakash, for your very kind introduction. So, more or less, what he has said is summarized in this slide, and probably for the meeting of today, I will insist upon a part only of my life, was has been first as a Department of Health DRG project director in France between a long time ago, 1982 and 1986. And that was the time I will be back later on. I work with Robert Fetter at the Yale University in the United States of America. And then, following this time, I was, among others, founding father of a worldwide network, Patient Classification System International, which at the beginning was named Patient Classification System E for Europe, but due to a success, I have never forecast such a success. It became PCSI International, and I am just coming back from Sydney in Australia, where was held the 33rd annual conference of PCSI. I am still very surprised that it still exists. For when we created that in the 80s, late 80s, we think that probably this will last, 10 years. 10 years. We will have been pleased by 10 years. And now there are more than 33 years. And as Dr. Prakash say, we organize not only an annual conference, this year in Australia, next year in Poland, but as well 2 schools, 1 full week training session. We call the summer school in June in Avignon, and has been held with success this year, 2017, and will be held next year. And another named Winter School, for its arriving a little bit before, and in April, and will be in 2018 in Cyprus, in Limassol, and you can still register for both of these schools. So I am starting my full presentation of the day. I'm sorry for that. I hope not to bore you too much by speaking too much. But the first one is was named by Dr. Prakash, Evolution of DRG case mix. So the third point is when you start to try to explain what is it, you realize that you know all the detail, technical detail, but what is it as a whole? So I think the best wording will be to say it is a technology innovation. But in this presentation, I will address this aspect rather in my following presentation after the break, okay? This, I will rather tell the story, how we started and how we has evolved. We should look a little bit as a saga, as a Ramayana, for you are in India, and we call rather in Europe an Odyssey, following old Homer story about the Trojan War between Greek and Troya. So to explain a little bit more what is DRG, I will say it is about healthcare management, it is about epidemiology, it is about quality of care, okay? And I will give more detail in my following presentation. So, the history, it can be distinguished in 6 different steps, and the future, the 6th, is still to be written, okay? What is sure is that the 5th author have been done. So, the beginning of the story was in 1967, I think most of you were not born at that time, in the Yale University, in the United States of America, for Professor Fetter, receive a requirement from the Federal Department of Health in the US to define what is the product of care, to allow some transparency in discussion, funding, management about healthcare. At that time, you see the US has embarked on in 1965 on the so-called Medicare program, which was meaning that the federal government in Washington will pay for all the hospitalized patients over 65. And so, and they will pay whatever is spent, okay? And so, in the following years, the spending increased like that. Before, some people were insured, some were not insured. And when you are not insured, you have to pay by yourself. So there was some restriction. But now, the federal government was paying. So what the physicians were deciding, what was done, was paid, okay? So that was in some sense fine, but they say that's not possible. We will wish to know what we are paying for. And they were knowing more or less what was the case in any other country before starting on the DRG. The number, even they were not knowing exactly the number of patients. They were knowing the number of stay in an hospital. And if the same patient was coming several times, they were not able to link the different stay. They were knowing the number of days this patient spent in the hospital, but nothing more. And so that was the reason why Robert Fetter, John Thompson, all his team, they have yes, that was in innovation. They invent the DRG, diagnosis-related groups.